Hello everyone, I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This is an updated version for June 2022 of breastfeeding support. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational purposes only, not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate as possible, but make no promises and guarantees, and expressly disclaim liability for errors and omissions. So the objectives of this section, I want everyone to be able to understand why breastfeeding is so important, be able to verbalize what are the national, international recommendations for breastfeeding, the history behind breastfeeding, the benefits of breastfeeding, what are the local resources available, the national resources, the different stages of breastfeeding, and how we as healthcare practitioners, birth workers, support staff can help get successful breastfeeding, especially that first few days and first month of life. Discuss the different ways that we can support breastfeeding with different latch positions, with helpful tips, even throughout brand new newborns all the way through toddlers. And then we'll go over the different ways you can support on a larger community level. So why is breastfeeding so important? Why is this topic something that we should go over? Sometimes it's common sense, but we have to state the obvious. Breast milk is literally liquid gold. It is something that can't be replicated no matter how much companies and other synthetics try to do it with formula in particular. They're never going to be able to replace what the value of breast milk has to the mother and the baby. Breast milk has so many amazing vitamins and minerals and antimicrobials that really are specific to what that baby needs at that point in their development. The mother and the baby have a very symbiotic relationship together, and there is so much value to being able to short-term and long-term breastfeed successfully for the mother and baby if that's the route that she chooses to do. Around the world, 155 million babies under 5 were established to be short, stunted growth due to not being able to have that proper nutrition. We had a lot of, and this is more underdeveloped countries, 52 million were estimated to be wasted too thin for their weight. And then we have the complete opposite. 41 million children are overweight and obese because a lot of times when they start them on formula and distending the tummy and feeding them too much, we get both extremes if we don't successfully advocate for breastfeeding. Breastfeeding benefits include improved IQ, improved school attendance, higher incomes, lower risk of infections, improved development, social skills. There's just, the list goes on, and then it benefits the mother as well. The mother has a decreased risk of uterine and ovarian cancers, breast cancers. The bonding, there's a lot of studies showing that the bonding is a lot better with the baby, short-term and long-term. The mental health disparities are lower with breastfeeding. So there's just a lot. As midwives and birth workers, we always want the best beginning for our family units. And it's not just about the birth, but it's also being able to advocate for long-term successful breastfeeding. So some of the other things that are really important, very few children get the nutritionally dense foods they need when they're starting out life, long term. There's very few babies. I mean, we biologically should be exclusively breastfeeding unless there's a medical condition or a preference the mother chooses. But currently, 40% of babies are being breastfed the first 0 to 6 months of life, and especially there's like a 98% interest rate in breastfeeding, and it just falls off a cliff, especially in a hospital setting for the first 48 hours of life. I mean, it's just amazing to me how quickly they go from 98% to 70% to 45% within just a couple weeks after the baby is born. And it's nothing that the mother is doing. It's our system and our resources. Our culture is not supporting her and the family unit to be successful. Over 182,000 children's lives could be saved under the age of 5 around the world if we had more optimal breastfeeding rates. It particularly has to do with the food, the nutrition, reducing the risk of infection, the development. I mean, many of these underdeveloped countries do not have water, do not have formula access. If the mother dies during birth or is separated, there's a high probability that the baby will also die if there's not access to another supplementation source. Undernutrition happens in about half of the child's deaths. So it's really, really important. I think we take for granted in the United States and developed countries, it's not life or death. We can go to the store getting formula. I know there comes and goes post-pandemic that there's formula shortages. So it's another reinforcing point that the mother's breast is meant to make the milk. It'll get the weight off faster. It'll help with her bleeding. It'll help with bonding. There's just so many benefits if that's the route she chooses after being supported. There's different organizations out there with different recommendation guidelines, and I think that's part of where the confusion sometimes happens. We'll dig into it more when we talk about why the breastfeeding rate decreases so quickly. AAP is the American Academy of Pediatrics, and they recommend exclusively breastfeeding for 6 months, continued breastfeeding as long as they both desire, even into the 3rd year of life or longer. I breastfed my first two for a year and a half, and then my second one for 2.5, and it was amazing after you get past a year of breastfeeding. The cultural norm is like a kid should be done breastfeeding. Why are you still breastfeeding? Are you not giving the kid enough food? There's a lot of culture misunderstandings that even if you're an expert in breastfeeding, it's hard to advocate for yourself, let alone someone that just doesn't really know and doesn't have someone on their team. The World Health Organization recommends that the mothers breastfeed exclusively the first month of life, and then thereafter is a combination and can be breastfed till 2 years and beyond. So around the world, I would say it's more of a cultural average to breastfeed for 3 to 4 years. In the US, it definitely drops off after a year, year and a half once the baby starts getting into toddler, and just being able to do it publicly, being able to do it with family support, with lifestyle, having another baby. There's just a lot of variables in place with long-term breastfeeding. Some other recommendations: early initiation of breastfeeding is really encouraged. The first hour of life, we'll talk about the golden hour and how important it is to get that initial high dose of colostrum. The mother's body, right after the baby delivers, the placenta separates. She makes 30 to 50 cc's of colostrum that first hour, and if the baby doesn't get it, it gets reabsorbed, and then she just makes milliliters, very tiny amounts, for 5 to 10 cc's at future feedings for the next few days till the milk truly comes in. So it is encouraged to do exclusive breastfeeding the first 6 months of life, slowly introducing the cereal to help with iron fortification. Slowly, like I think that's another thing with our culture. We are introducing foods and more solid substances to babies way faster than their digestive system and body is meant to have. You can do always little tastes, but I think our culture and society is, we want them to be big, we want them to grow fast. It shows they're overachievers. Our society is always wanting to accelerate growth and awards and achievements. So we always have to be careful with breastfeeding and that nice transition with combination of food and cereal. Many babies do not even receive optimal feedings. For example, only 36% of babies between the ages of 0 to 6 months worldwide are exclusively breastfed between the years 2007 to 2014. Theoretically, it should be 95% plus, because if we're supporting families, there is a strong interest in breastfeeding. The only times it shouldn't be happening is if the mom has a medical condition making it incompatible for breastfeeding, or she's had good informed consent and she chooses not to breastfeed. But most of the time what happens is there's a high probability, especially in the traditional medical system, that the parents want to breastfeed, but then the system is not set up to support them. The nurses have in postpartum 6 mothers, 6 babies, 12 patients, lots of things to do. They can't sit in a room for an hour, hour and a half and help. And a lot of times the lactation consultants in the hospital are super busy, and they may or may not be able to see them before they discharge. So I do feel like community-based midwives and birth workers and lactation consultants have a huge advantage and very different statistics of the outcomes because of the advantages we have of the additional time, education, the quality of care when we're not part of the bigger healthcare system makes a huge difference. I know with my private practice, the birth center home birth practice, we had like a 98% breastfeeding rate by 6 weeks, and I wanted to do some long-term studies after 6 months and a year. Yes, we have the more clientele and culture that is more natural, and they do the research and they have a little stronger support system, but it's a pretty drastic difference when you do the midwifery model of care. You have physiological birth, you do normal breastfeeding, you do skin to skin, you're educating normal birth, normal breastfeeding, and it makes a huge difference in the success rate and being able to support them in the home setting at a more realistic timeline. So we should go back to the history of breastfeeding. I think it's important for people to understand there's some really good books out there about the formula company and the barriers that were before formula. Moms, if they couldn't breastfeed or didn't have a wet nurse, the baby would die. There was no ifs, ands, or buts. And then when formula came out in the 1920s, it was this huge thing, and then it's trying to replace what the moms do. We had a huge swing of in the 1950s and 60s that barely anyone was breastfeeding anyone anymore. Everybody thought that formula was better. They thought that that was the best option. It was so amazing, so convenient. The mothers could go back to work. They could have their bodies back. There was a lot of lack of education, and we are in a backswing of wanting to promote breastfeeding, seeing the implications of having so much formula in our society and culture in versus starting to get more breastfeeding initiations. So there's been a big change over the last 120 years of what you could do, what you could offer, and we're now in a place where formula shortages, formula doesn't have nearly the benefits. The research shows time and time again, it is better for the mother and the baby to breastfeed as long as they can, as long as the mother is wanting to do that. So even though formula had came out in the 1890s, it was very interesting how it had occurred. They were trying to find a desperate way to help save babies' lives. If the mother had died, if they were separated, this was life or death to these babies. They tried as best they could to humanize cow's milk and mimic the properties that were within it. So they created a mathematical formula. That powder that's in there is a trying the best they can to make the similar percentages of fat, protein, and sugars, but it's never going to mimic the day-to-day changes, the timing changes, the developmental. It's always the same in that package. They can have lots of labels, they can have lots of variations, but if you read the back of the ingredients, they're pretty much all identical. So you want to just make sure that we're stressing how important breastfeeding is if that is an option. If it's not an option, we're so grateful we have other means necessary that are available for us. So other things with the history of breastfeeding, we had a huge influx of mothers needing to go back to work during the war, and especially nowadays in the 1970s, 80s on, both parents are having to work. The mother is getting barely any time postpartum before she has to pay bills and take care of the family. Our culture puts a lot of pressure on the mothers to just get back to normal as soon as they have a baby. Many other cultures will have 30 days of rest, they'll have paid maternity and paternity leave for 6 months to a year. Our society is very, very fast paced. And because of that, we don't get well established breastfeeding. We have mothers that are tired and exhausted. They want to schedule the feedings. Formula is easier initially. You can feed the baby every 2 to 3 hours. You get their tummy overfilled. They sleep, they eat, they sleep. Breastfeeding the first few weeks is a little bit harder, but once you get past the learning curve, it typically is much easier process than doing formula, and it's much more cost effective and better outcomes for the mom and the baby. So there is a lot of challenges where birth and breastfeeding has become more and more medicalized. It has become a business. It has become an opportunity for women to not be empowered, that they need formula, they need epidurals, they need all these things. They need an obstetrician, they need a C-section, they need some of these interventions that may or may not be the best for them based on a financial bias and the educational system that's being done for the healthcare practitioners and the consumers alike. So other things with breastfeeding history, it changes all the time in culture and it makes a difference. Did you grow up in a family where everybody breastfed, or is it something where your aunts and grandmothers, everybody formula fed and now they can't support you? There is a lot of things where the doctors would come up with all these theories of why a mother shouldn't breastfeed, why giving her the mindset that you're not making enough and it's just easier and the baby, this is great. The formula is just as safe, if not better, than your breast milk. And so a lot of our society is just shifting more and more that the breasts are more of sexual objects versus they're used for breastfeeding like other mammals. It's very direct correlations in societies between how a woman's body is looked at as a sexual being, her vagina and her breast, with C-section rates and breastfeeding rates. There's huge correlations with societies and how the woman's body is viewed and how it's having those other purposes being idealized. So the World Health Organization, I wanted to update this. We had 2030 breastfeeding objectives last time, and so I want to update it to 2030 now, and just showing their goals. And even their goals, to me, I'm like, this is we've got to increase. I get that, but we have a long ways to go. So the goal is to have exclusive breastfeeding through the 6 months of age to around 42.4%. The baseline right now is around 24%, 25%. So, I mean, to me, I was like, we need to nip it in the butt. We need to get it to 70, 80, 90% aggressive as possible and make very high goals and targets and policy programs that truly support it. With the Affordable Care Act, many private lactation consultants can't tap into that credentialing and that insurance. The hospital systems don't really do much with the Affordable Care Act. Very few pediatricians' offices do the Affordable Care Act. So there's a lot of policies in place, but then there's a lot of barriers that the private insurance companies are dictating how that's reimbursed into that support. So there is some difficulties with education and with aggressively going back to work, financial demands. The other things are their goal by breastfeeding at 1 year. They want to have a target of 54% and it's around 35%. And this is in combination of food and breastfeeding. The first one is strictly just breastfeeding. So I found these statistics interesting. So these are from the CDC's website, breastfeeding statistics. I do not know why they do not have Michigan and California on there. I thought that was very interesting. Those states did not get that data. But you can see very concentrated pockets that the breastfeeding initiation rates really plummet culturally. You can see the regions, you can see the areas. It's not like it's scattered all over the place, rhyme and reason. You can see in the central US and the northwestern US, the breastfeeding rates are the highest. You can see in the southern states, Alabama, Georgia, Mississippi, Louisiana have very low breastfeeding initiation rates. And then there's a strong pocket near Virginia and Pennsylvania. And then the East Coast, and especially towards Maine, it gets a little bit better. So there's a lot of cultural diversity that is impacting the norms and the expectations. It's not that it's scattered rhyme and reason. This hospital does it this way. It's the community. It's the generational gaps. It's the resources. It's the policies and the value that these local states and federal programs are putting into place to help with breastfeeding success. So this is another statistic of the breastfeeding rates in the U.S. from 2018 to 2019, the 6 months of life, and it's also similar to what we were seeing on the initial exclusive rates. So Oregon and Vermont have really high breastfeeding rates, and I would love to see their policy reforms, the culture, the mindset, why certain states are really, really high and why states are low. So the Midwest, it's kind of average. Southern states are the lowest. The little bit of that northern tip of the East Coast and the West Coast in Alaska. So I think the more rural something is, where you have barriers of accessibility to formula or the cultural mindset, you live more out in the country, you tend to be more natural, you're on the farm, you're more familiar with cows and more the natural process of how a baby is fed. I think there are a lot of influences impacting these breastfeeding statistics. So this is from the CDC, specifically the national averages from 2019 to 2020, the key indicators that they've been watching for any baby that's ever been breastfed, 83%. I know that a lot of hospitals will do initial admission questions. Are you interested in breastfeeding? So it always is interesting how it is always higher, the level of interest, to the ones that actually got a chance, whether they had a C-section, they were in the NICU, they were separated from their baby. It goes down pretty quickly. And then the breastfeeding rates the first 6 months of life, this doesn't specify exclusively, 56%. Breastfed at some point the first year and continued to that point, 35%. Exclusively breastfed for 3 months, 46%. Exclusively breastfed for 6 months, 25%. And then the percentage of employers that have work site lactation support, there are federal laws and things that are supposed to give you breaks, that are supposed to allow you to public breastfeed, are supposed to support you. But as you can see, 51% of the companies actually have those programs and policies and things in place to help a mother continue breastfeeding after she goes back to work. And then the percentage of babies that get some form of supplementation, whether it's medically, whether it's mother's tired, convenience, there's multiple reasons why she may be giving some form of formula, and it's pretty much 20% of the population. And so I would love to see more data and statistics, how much it really is supposed to be, or how many times maybe an intervention is being done a little faster because the nurse is busy, a nipple shield, they just say the baby's not getting enough because they're taking care of lots of people. There's not a lot of education before they have the baby to really understand the benefits, and that it takes time, and how to support them with good latch and skin to skin. There's a lot of breastfeeding disparities that exist. Unfortunately, just like birth, it also is with breastfeeding. Fewer non-Hispanic Black infants are ever breastfed compared to Asian infants, non-Hispanic white infants, and Hispanic infants. Infants are eligible for receiving more special supplementation programs, WIC. They're more likely to not breastfeed if their baby is eligible for WIC. So those are those challenges, because a lot of times the disparities are the lower economic status and minorities, and so there's an easier access to free supplementation. Younger mothers are less likely to breastfeed, and so a lot of times if you're older, you're well educated, you had college, you started your degree, you had a little money saved up, you're a little more in a financial stable place, and a little more research, mature life experiences. So the older the mother is, traditionally the higher the breastfeeding rates are. So if we could get more programs for our teenagers, our younger moms, and our minorities. So if we wanted to focus on making the biggest change and impact, just like in birth, we should be focusing for breastfeeding. So these are some of the things that I think is really important as birth workers, midwives, lactation consultants, birth assistants. Why do mothers stop breastfeeding early? Our goal is to support and advocate them, especially that first month of life, to make sure that they're advocating for themselves, they're being empowered, they know all the resources, education, they've got the support groups in the area, they've got tips and tricks and tools to help them be successful. So 60% of women do not breastfeed as long as they intended to, which, hearing that statistic just makes me absolutely break my heart, because we are failing families, we are failing mothers, we are failing babies. They want to breastfeed, and overwhelming women do, and it's not happening. So what are the major factors? It has to do with the lactation, the latching, the issues with milk supply, pain, latch techniques, lack of breastfeeding education, lack of lactation support services, a lot of fears, misunderstandings about, is the baby getting enough food? The pediatrician's algorithm for the weight, it tends to be a formula curve versus a breastfeeding rate for weight. And so sometimes these babies are being put on supplementation, or the moms are given fear and anxiety that they're not making enough for their baby, purely because the baby is being placed on a growth curve that is a formula statistic growth curve, not a breastfed. So we do this all the time as midwives. We want to advocate. We want to talk to them. We want to get midwives to get our clients to ask the right questions at the pediatrician. Just like with birth, you want to know your choices, your options. And when your baby comes, you want to teach them to ask the right questions, do the right research, figure out what is the best option for them. A lot of women will stop breastfeeding because they had to have surgery, they had to start a medication. There's a lot of misunderstandings with healthcare practitioners, the healthcare system, of what meds are safe while you're breastfeeding. There's very few meds that make it so you cannot breastfeed, but it's usually cautious education because the practitioner doesn't really know, they haven't done the research and data, so they'll just be overcautious, just pump and dump, wait 24 hours, and it creates this vicious cycle that may not necessarily need to be there. Their workplaces do not have very good supportive policies. They don't give very much time off of work. They don't have financial parental leave. The FMLA may not be there. So it's a lot of times just a challenge that they have no choice. They have to go back to work, and they may have not established the milk, they may not have breaks to pump, and they just have to formula feed. It could be a lot with cultural norms. We talk a lot about that. If you're surrounded by a whole family that breastfeeds and that's normal versus you're the first one out of your aunts, grandmas, sisters, cousins, it makes it a lot harder. And even your partner, like if they haven't seen normal birth, normal breastfeeding, it's definitely a learning curve to help advocate for yourself. And many of the hospitals have unsupportive protocols, policies, educational material. It tends to be a little more medicalized than necessary for some of these babies because they aren't given good evidence and educational opportunities. Some of the policies are outdated. Makes a difference if the hospital has a breastfeeding, the initiatives that are being done so they can get that stamp of approval. So some of these community-based hospitals, they're old school. The nurses have been there a while. They're not keeping up with the data and the resources that are available. So breastfeeding is a hard topic, kind of like circumcision, kind of like natural birth, epidural, like do you do the hospital, do you home? Some of these topics can get really, because there's strong beliefs on both sides that some women can't make the milk, so you don't want to make them feel bad. And I read an excellent book about the history of breastfeeding and formula feeding and how much a divide was created by the formula companies, women against women. And so then it creates such tension versus we have honest conversations. We talk and we just give unbiased choices. We're like, these are the benefits, these are the risks, these are your options, these are your resources. What would you like to do? And then we support the mother in whatever choice she wishes to do. I think sometimes moms feel guilty because they don't want to breastfeed. Maybe there was some trauma. Maybe they can't breastfeed. Maybe they're one of those rare women that has anatomical issues. There's so much guilt when women don't get the natural birth, or so much guilt if they don't breastfeed their baby, and so people just don't talk about it. And so we really want to make it an open, comfortable, whether you want to breastfeed in public, whether you want to breastfeed in private, whether you want to breastfeed for a couple weeks, you want to breastfeed for 4 years old. We want to support the mother and her decision she's made that she feels is best for her and her child. So it's hard. It's a big part of their identity, being a mother, having a successful birth, in their eyes, whatever that's defined as, and a successful breastfeeding. There are huge correlations with mental health disparities, bonding, the overall outcome of that lifelong impact of how the mother views her choices and empowerment around her birth and her breastfeeding experience. So it's totally her choice, but we also sometimes give biases, or there's sometimes, especially being home birth midwives, we think everyone wants to breastfeed. We don't even take the basic step back to just talk about their history, talk about what happened with their last baby, talk about concerns they have, and then let's see if we can make a plan together that fits for what she's looking to do. Sometimes you can't even just talk about breastfeeding. You can't talk about circumcision. You can't talk about birth. You can't talk about midwives in certain cultures and situations because it gets so much tension and so much extremes of beliefs on one side or the other. And so I think in our society, we're seeing that more and more of any topic. It's hard to have an open conversation without biases and truly looking at the data and knowing and trusting that empowering the family that they're making the best decision for themselves, because you don't know, maybe financially she has to go back to work, no ifs, ands, or buts, and how can we support her through it? Maybe she can get a pump, maybe she can breastfeed at work, maybe she can't. We just have to be able to look at the guidelines, see when it's appropriate to breastfeed and when it's not. Because if she has HIV, there are rare medical conditions, rare medical medications that make it so we do not encourage breastfeeding, but most of the time it is the best option for mom and baby. So the benefits of breastfeeding, we could go on and on and on and on. There's really no risk unless they have that rare medication, rare medical condition that is contraindicated, but most of the time it's just all about the benefits. It's truly the mother's body giving the baby the best nutrition, needs, the amounts, they communicate to each other. It's absolutely amazing, the relationship between the mother and baby. Um, Helps to boost infection immune system, so we're preventing that infection, protecting from obesity, the stomach's not getting stretched out, the milk flows a lot slower, the baby can be satisfied and separate in versus the bottle. Even formula fed babies and breast expressed in a bottle have very similar outcomes because they're just getting the milk too fast in their tummy. You can get special nipples to help slow down in the bottles, but it's just very different. There's stages of flows with breast milk that the bottle just does the same the entire time. The baby's IQ, the development, they're getting absolutely every vitamin and mineral and protein that they're not going to get from formula to help with those critical times of digestion and development. It's going to lower the risk of breast, ovarian cancer, diabetes, osteoporosis, arthritis, autoimmune conditions, depression. The list goes on and on of all the benefits to the mother. She has a lower rate of bleeding after the baby comes. She has higher bonding. It's overall better if we can support her wishes and help break down those barriers. It's more comfortable for the baby and the mom. It's a soothing thing. It's not just about transitioning the milk. It's warm. It's the right temperature at all times. It's easy accessible versus you have to warm up a bottle. In time at 6-8 weeks postpartum, babies are usually eating every 2 to 3 hours for 5 to 10 minutes. So it is a lot easier for most women long term if they don't have to quickly go back to work. They have a work that's supportive. They've been successful with their resources, education, getting a good latch, getting a good milk supply, being able to be well supported by their community and their care providers. So breastfeeding protects the baby from many different diseases. There's a lot of people that will use formula, they'll use soybean sources, they'll use cow's milk, goat's milk, and they just lead to so many long-term allergies, autoimmune conditions, diabetes, infections, digestive issues, intestinal bleeding. If we could just get more babies to breastfeed, it would be amazing, the literally millions and millions of babies that we would impact a lifelong better experience, preventing especially particularly the risk of death. So, I mean, just thinking of how many pediatrician visits we could avoid with infections, how many babies would thrive and be resilient for our next generation. I do worry terribly about all the changes with healthcare and all the demands and all the things we're putting in our body, the nutrients, the fertilizers, the chemicals, the water supplements. There's just so many things we're putting in our body now that if we're taking away the breast milk for the baby, they're just getting another added artificial preservative that's not the best for them to have their body live off of. So the list goes on, and I just want to reinforce, even like just with reducing the risk for the baby of heart disease, diabetes, cancers, cardiovascular issues, obesity, sudden infant death syndrome, the #1 risk factor, and they don't talk about it a lot, and that's what's always hard for me with a lot of these conflict of interest with bigger companies putting out flyers and information, that with SIDS, the #1 risk factor could be, or the risk reduction measure would be just exclusively breastfeeding. As soon as we start adding in formula, the statistics for SIDS just goes through the roof. it's really important if we can. There's so many benefits for finances, for bonding, for the mother, for the baby, for sleep, for mental health. There's just it's a no-brainer if that's something the mom and the is a good fit for her. So there's different levels of the breast milk. When the mother is pregnant, sometimes she will have leaking of the colostrum throughout the pregnancy. It's not a myth of how much milk she's going to make. Some women leak before the baby is born and some women don't. The second stage of milk that comes in is after the placenta separates and the colostrum, and that's where a lot of midwives will give education if they had a later miscarriage, stillbirth. The body doesn't know the baby's not here. They'll still go through engorgement. They'll still get their milk coming in and helping them through that process. And then the last stage that for the milk comes the hind milk, the fore milk, the milk the baby lives off of long term at day 3 to 5, and that is continued on from the baby suckling at the breast or the stimulation. The first two stages purely happen because she got pregnant, the placenta separated. For the milk to come in and continue staying long term, the nipple and the breast has to be stimulated by the baby or a pump. So the breast milk contains absolutely amazing things for the baby, things that the formula will never ever be able to make. I know they're trying right now to do some stem cells from mammary glands and try to make the best, closest formula or synthetic version of mammary milk possible, but they're never going to be able to compete with what the mother can do in real time, adaptable, and change it based on the baby's mouth and nose and hands touching that breast and telling the baby, this is the germs I've been exposed to. I need some antibodies to protect me from it. So they're never going to be able to replicate that. So it saves time and money. With the Affordable Care Act, you can get a breast pump. It just depends on if you have to go back to work right away and how often the baby eats, but you're not buying formula that's in a can for $30, $35. It's always free, fresh, and easy available. You do have to pump, you do have to spend a little time storing up if you're separating from your baby, but if you choose or you have the option of not being able to have to go back to work and stay with your baby, you're going to save money on not just the formula, but also the doctor's visits, the medicines, hospitalizations. There's just so much benefit financially to our family. So we already talked about the different stages. The baby's mouths are very, very small initially. The tummy is very small. It's like the size of a marble. I think the next slide I will show you the different ranges. So we have a lot of misunderstandings what those babies need when they come out. Like we joke, but we don't joke. The mom's working really hard during labor. She may or may not be eating much, but that baby is eating until that umbilical cord is cut. So that baby is getting nutrition and blood flow and oxygen and everything from the mother until right after delivery, and they don't need much. They have reserves, they have storage. The colostrum, those tiny concentrated amounts, is absolutely everything the baby needs at the beginning. So we really have to just educate the mothers because it's hard. They're not hearing an audible swallow with the colostrum. It's 5 to 10 cc's. It's thick, it's sticky, it's hard to see. And so the moms get anxious and nervous that they're not giving their babies enough. It's like a bottle, you can see it going in, you know what's going in. So we have to do different education about listening to our babies, not communicating with us by words, but communicating with us by their rooting reflex, their hands, they're interested in eating and they're showing us hunger cues, and then when they're breastfeeding they separate, they detach, they're satisfied, they are the ones that are showing us their hunger cues. You just don't put a time clock on the baby, you allow them to latch, you allow them to detach on their own. And we always stress what goes in must come out. If you're getting the pees and poops that you're supposed to be getting, it's a no-brainer that the baby's staying well hydrated. The first day, the baby will have 1 wet and 1 poop minimum. Day 2, 2 poops, 2 wets. Day 3, 3 of each. And then once the milk starts coming in, the wet diapers will drastically increase to 6 to 8 a day. Many times every single feeding you'll be changing a diaper. In time, some babies will stretch out their pooping with being breastfed up to 7 days, and then it's normal. It's extremely rare for a breastfed baby to get constipated. It's a different conversation with formula fed babies. So we just want to have good education with our moms about You feed them when they're showing you signs they're hungry. They're not on a schedule. We take drinks scattered throughout the day. We snack. They may want a little bit, they want a lot. You just have to learn to listen to your baby, not try to schedule them on feedings right away. Try to just listen to when the baby is hungry and thirsty, and wanting to nurse versus we're trying to look at a clock and wonder, has it been too long or it's been too soon to feed them again? So this is that perfect diagram that I was talking about, and it's a great example for your families to reinforce this is normal. Day one, all they need is 5 to 7 cc's. They don't need much. And moms will try to pump and they're like, oh, I can't get it off. It means I'm not making anything. The baby will draw the colostrum and the milk off far better than a pump will ever do. And so we really want to reinforce, maybe you only get 2 ounces off when you pump, but I bet you that baby's getting closer to 3.5 ounces, because they're able to pull the milk off your breast a lot better than the pump ever will be. So by day 3, it's more closer to 3/4 of an ounce to an ounce. And then the first week, once you get your milk supply in, the baby will drastically start getting closer to 1.5 ounces, 2 ounces. And then 1 month, it's very interesting. Some babies will eat 2.5 ounces, all the way up to 5 ounces. And that could be a norm the entire time. Some babies will eat 3-4 ounces of milk and stretch out feedings. Some are more snackers. I joked my first always liked to top off his tank. He just ate a little bit all the time. And so there's a personality that comes out, and he's still that same way being 12. He's a snacker. And so I always want to stretch. Every baby is different. Every situation is different. Your milk supply, you may have a baby that transfers the milk better. You have a baby that wants more in concentrated amounts or wants a little bit at a time. It may be more of a comfort, and they like to just be on the breast and be more secured by being by the mother. So we don't really want to schedule the babies. You'll learn your baby's routine and through growth spurts. So you're going to notice when they're sleeping more, they're going to eat more as they're growing. So these are those growth curves I was talking about, and you just got to make sure the pediatrician's office, are they using the CDC? Are they using the World Health Organization? Are they using a growth curve that is based on formula-fed babies, or is it a growth curve based on breastfed babies? Because they are very different curves. So this one is the breastfed infant curve, and it's just really important because we see it all the time. Families are told to supplement because the pediatrician's office, the family practice office, the lactation consultant is using the growth curve that's meant for formula-fed babies, which is very, very different and more aggressive weight gain. So the different stages of milk, you start making milk as soon as you become pregnant. The colostrum comes in as soon as the delivery occurs, the placenta separates, and then that transitional milk, those first couple weeks, and then it's just the regular milk that the baby is taking in until you wean the baby off the breast. So mature milk is that final stage. 90% of it is water, which is really interesting because we have some moms that are just overachievers. They pump, they're making lots of milk, and then we're trying to figure out, why is the baby not gaining any weight? They're making so much milk, the baby's getting closer to like 100% water. They're not getting that tail end of the carbohydrates, the proteins, the fats, the things that are so essential. Some women have overabundancy issues, and then we would talk about blocked feedings where we focus on one breast the entire session, and then next session we would give the other breast so that we can guarantee that the baby is getting that tail end that keeps them satisfied, that gets them to get those nice cute rolls. Because if they're just, they'd be like, okay, they're drinking all the time, I don't understand, they don't ever act like they're satisfied. Well, they're getting all the water, but they're not getting any of the fat that's going to keep them more satisfied and get them to have the energy and growth that they need. There's 2 types of mature milk. There's the fore milk. It's what comes at the beginning, and then there's the hind milk that releases after the initial. It contains a lot more of the fat, and a lot of women will have tingling in their breasts. They'll be able to tell. The babies, it immediately changes the flow. They're sucking and pulling and sucking and pulling, and then all of a sudden it's like a fire hose opens and it sprays everywhere. The baby sometimes cough. My mother-in-law would always joke, oh, there must be milk in that bones, because it was always classic. As soon as I felt the tingling, I would almost try to take my baby off a little bit because they would just get the floodgate opened and they would all of a sudden not be able to adjust to that quick increased flow from the fore milk to the hind milk. It's encouraging the mothers to use their prenatal vitamins while they're breastfeeding as well as pregnancy. I don't think they named it appropriately when they call them prenatal vitamins because most people think you should only be taking them prenatally, and you should be taking them anytime you're preconception and you could get pregnant, anytime you are pregnant, and postpartum, because it gives you the extra vitamins and minerals that you're not getting from the everyday nutrition. I always joke with mothers, I'm like, the prenatal vitamins are not for the baby, they're for you. The baby gets everything they want while they're growing inside of you, and while you're feeding them, you get whatever's left over. You get the nutritional deficiency from the vitamins and minerals. Those prenatal vitamins are for you. So getting a baby in the right position, this is a very common challenge of latches and nipple pain and not transferring enough milk, and it hurts, and it creates a vicious cycle, and it's a lot of the reasons why women will stop breastfeeding. So it's really important that we help them. We stress that they're breastfeeding, they're not nipple feeding. You want to get as much of the areola on their mouth. As you can see from these two pictures, that there's too much of a gap. The baby, you're not going to make your baby have trouble breathing. They're very smart. They'll pull their head back. They're going to pick breathing over eating any day of the week. So we want to get them close. We don't want them hanging off your breast. We don't want them just attached to your nipple. They're not going to transfer the milk well. It's going to be super painful. As you can see the pictures from the breast tissue, you want it way in the back of their mouth. You don't want it just in the forefront roof and tip of their mouth. So the different types of breastfeeding positions out there, you can do the cradle hold, which is more the traditional one. You can cup the breast, make a little sandwich for the baby, tease the baby a little bit with the breast and the nipple on the nose, and then when the baby roots and opens nice and big, you'll put the baby's mouth in on the breast. You can help support the baby. I am a big fan of more natural, laid back breastfeeding, letting the mom be semi-reclined, let the baby get aroused and interested in breastfeeding, because sometimes we're too aggressive trying to force the baby to breastfeed when they're not ready to do it. I give the example, if I woke you up at 6 in the morning and I shoved a bunch of buffet food in front of your face and you just woke up, you didn't know what was going on, you're not that hungry, you're going to pull away, and some of these babies' personalities, they don't like to be forced to do things. So you just got to let them have their own pace, learn their personalities, learn how they like to eat, some positions they like better, some of them like one breast over another better, depending on how mom holds the baby. So there's a lot of variables with breastfeeding, and so not one position is always going to work exactly for every single time, and as the baby grows older. So the crossover hold is another popular one. You can put a breastfeeding pillow underneath. I encourage you to be well supported. Your back's going to be sore. Your arms are going to be sore. If you don't have pillows and you don't have a well supported position, there's great rocking chairs. There's great breastfeeding pillows and things you can do to help support. So the football hold is a great one for moms with larger breasts, for toddlers. If she's had a C-section, her belly is really tender. Maybe she's had a lot of babies, and that uterine cramping gets pretty intense those first few days. So it's a nice option for certain types of women to breastfeed. They can see a little better. There's no right or wrong, and so you just want to try a few different ways and see what works best for the mother, the baby. The laid back one is honestly my favorite, especially when we look at biological. It just takes more time for biological nursing. Put the baby skin to skin, let them smell the mother's milk, her skin, hear the heartbeat. They will root just like a puppy and kitty will on their mother and go right to the breast if we give them enough time and we're patient. So it's a great option when you're tired. It'll help with the letdown. The mom is relaxed. She's confident her body knows what to do. We stress all the time. Your body knew how to grow this baby. Your body was born to nurse and feed this baby, and the baby was born to nurse off of you. It's a very strong instinctual relationship together. So we just have to give time. Our fast-paced society does not give breastfeeding time to let that biological instinct take hold. Sideline breastfeeding is a great option for some mamas. It's a little more advanced. Some women love it, some don't. It's a great option for breastfeeding at nighttime, and depending if you have large breasts and just how you're feeling, it's a great option as the baby gets older. It's a little harder when they're a brand new baby. Some moms can do it, some can't. So it's just about giving choices and options. So we always stress there's that feeder meter. There's ways to know if the baby is hungry or if the baby is satisfied. The baby communicates with us. They just don't use words. So we have to learn their language. We have to learn their cues they're giving us. Are they tense? Are they crying? Are they alert? Are they rooting? Are they sucking a lot? Are they opening and closing their mouth? Their hands are feeder meters. The more tense they are, the hungrier they are. And we want to try to feed them before they get too hungry. Otherwise, it gets very difficult to get a latch because they're just so over hungry. So many of our society thinks crying is the only way. If they get to crying, we're usually too late. We didn't listen to their little early signs. And I stress to people, the babies are very, very smart. They're going to be more content and less likely to cry if we feed them early, we listen to their other cues. Crying is the last stage, and if they realize conditionally that you only respond to feeding them when they cry, they're more likely going to skip the other ones and they're going to choose to just go right to crying. So it's important to offer skin to skin, feed them often, even if they want a little bit. If it's a little simple thing to offer a breast to a baby, if you think they may be hungry, they're going to choose to nurse or they're going to choose not, especially when they're older. Like, you can't force a baby to eat if they don't want to eat, and you just have to offer, and they may take a little bit of sips and they may do a full feeding. So just try to make it more laid back and listen to what the baby is. These are ways to tell if the baby is full. They're going to release themselves from the breast. They're going to turn their head away. They're going to relax. Their fists are going to be open. Their body's going to turn into this loose jello. We call it like the milk coma. They just are completely flaccid. They're happy. They're content. They just had the best feeding in the world. You're going to know when they're full. What goes in must come out. So changing the diapers, don't stress so much about how much are they getting in. Are they getting a half an ounce? Are they getting 3 ounces? It doesn't matter. We don't calculate how much water are you drinking right now. You drink when you're thirsty, you drink more when you're more thirsty, and you take a sip when you want a little bit. So we have to have that same mindset with our babies, listening to their hunger cues and their feelings of being satisfied. So yeah, those little cute feeder meters, when they're half full, their arm's going to be halfway up. If they're super hungry, they're going to be next to their face. They're going to be tense. They're going to be tight. And then when you're at the tail end of breastfeeding, that arm's going to be just hanging there. It's going to be all relaxed. You can do whatever you want with it. The baby usually falls asleep. It's a wonderful thing, breastfeeding, and knowing that your baby's getting satisfied from feeding off of the mother. So the breastfeeding demands, we do encourage breast milk the first month of life. We don't encourage any other supplements, no water, no juice, no food. There is a lot of studies to start offering after first 6 months of life, a little bit of cereal, not much. The babies do not need much. In the hot summer times, they're just going to nurse more often. The mother's breast milk is all they need the first 6 months of life. And they're mostly the first year going to be mostly breastfeeding. The food is just a tiny bit of little supplementation, tasting, very softened, slow introduction. Our society introduces it way, way faster than the guidelines actually recommend. So early in the beginning, getting skin to skin, getting a good breastfeeding routine, getting a good supply, transfer, letting the baby be comfort. I mean, literally the first couple weeks in a perfect world, the mom and baby, like they do in many other cultures, would just be taken care of. They'd snuggle, they would have all this support so that they can really have a successful start to breastfeeding and that bonding relationship. Their bodies need so much. They digest the milk easily. Like, I stress, I'm like, you may be feeling like you nurse all the time the first couple weeks. It takes an hour, hour and a half to nurse a baby. They take a little break off and then they're back on the breast, and that's normal. That's okay. Once the baby gets good at breastfeeding, your milk supply gets well established, by 6 to 8 weeks, it tends to go to that curve of every 2 to 3 hours for 5 to 10 minutes. So we just have to help them through the learning curve and supporting them that this is normal. Their body is not, too many women think they're not making enough because they're comparing themselves to a formula fed baby. And so we have to break that concept. We have to get mothers to understand what's normal and what's a formula fed baby. So we talked already about the iron stores. The mother gives the baby iron during pregnancies, but the breast milk does not transfer iron. And so it is encouraged. You could do the iron supplementations. You could do a little bit of cereal. There's a little bit of things that the pediatrician will recommend that is not given. Vitamin D, you can give them a little sunshine, and the iron supplementation. Babies that are breastfed, the more you can get them to breastfeed, the lower infection rates, the less likely of respiratory issues, less digestive issues, colic, allergies, the list goes on and on of all the benefits of breastfeeding. So there's simple things you can do. I think our society, we've talked about it over and over again, but we introduce food too quickly to our babies. Maybe they're on formula and formula is expensive, or we think it's so cool because they're rooting and they're tasting things and reacting. We mush up things. We give food too quickly. We cause allergies. We cause digestive issues because their bodies are not meant to have anything outside of breast milk the first 6 months of life. They're still learning how to use their tongue. They're still learning how, I mean, they don't even have a swallow reflex. It's a spoon. And it's amazing. Like one of my kids, we started introducing food around 8 months because he was showing interest. He would grab at things. He'd be curious. Listen to your babies. If they are interested in one of my kids, it was 6 months because he was showing interest. And it would just be little tastes. They do not need much in the beginning. Their tummies are too tiny for what we're trying to put into them as our large American portion size. So every organization is stresses and stresses that breast milk should be the main source of nutrition for the babies the first month of life, exclusively the first 6 months, and then a slow gradual introduction of the baby food, the tasting of things, gradually implementing softer foods and solids. And so this is just a simple reference point. You're giving them one meal of solids a day at age 6 months. A meal is literally like 2 spoonfuls. It's a very, very small portion if you actually look at the database of what it is. Then the 2 feedings by at age 7, and then 3 feedings by age 8 of month, and then 3 feedings and snacks. So you're giving very minimal. You're giving them a little taste. Maybe you bite something, you chew it up, you give it to them after you've done it. Like, it's not them sitting at a tray and having a full meal just like you had. We have to be gradual and careful in introducing the foods and transitioning the babies. So breast milk is just so important. It should be their primary food source. The food will be gradually a supplementation from the table. The longer we can breastfeed, the better the babies are going to be. The benefits are going to last the mom and the baby an absolute lifetime. So after the first year life, we already talked about it, toddlers, I mean, around the world, we breastfeed for 3.5, 4 years. That's the norm. But in our society, particularly when you get after that first year, year and a half, you get harassed. There's a lot of cultural misunderstandings. And so it's really important to support and stress this breast milk is absolutely vital for the success of the baby's development until the mom is done wanting to nurse. So if we can, a lot of the guidelines are encouraging World Health Organization, if we can get babies to breastfeed a minimum of 2 years, that would be the gold standard. And you could tandem nurse, you could nurse your toddler. There's no right or wrong. A lot of myths and misunderstandings of our society makes fun of toddler breastfeeding. I mean, we do not fully understand it and appreciate how important toddler breastfeeding is to the mother and the baby. So the more that we can get our long-term breastfeeding rates up, the better it's going to be. But if we're not even getting successful initiation, we're not going to have long-term breastfeeding rates. So we've got to tackle that first 48 hours in the hospital, tackle our society longer term of the culture, the misunderstandings, the true benefits, and the things that have been put in our society for so long with formula. So we have to get to all the stages. We can't have successful 2 years of breastfeeding if we can't even get past the first 6 months of life. So the big things to stress, so ways to improve this success, education before delivery, getting our society culture more aware of all the benefits, the golden hour, getting the baby to nurse really well, that first hour of life, lots of skin to skin, stressing normal breastfeeding compared to formula feeding, and really being a good support for them. Like I can't stress it enough. Our society has so much misunderstandings around breastfeeding and what is normal for postpartum transition for a mother and baby and how to support them. So our job as midwives and healthcare practitioners and birth workers, LCs, birth assistants, is to just reinforce normal. We have an advantage with being community-based midwives versus hospital system of embracing normal. We're in their home setting. They chose an alternative practitioner. They're already doing a lot of research. We tend to have higher breastfeeding rates for our clients. So we have to figure out for those ladies that transfer to the hospital, our ladies that choose not to deliver in the community-based setting, how can we support them? And it really comes down to more prenatal education, more true physiological breastfeeding support in the hospital and when they go home, more programs to allow for paid maternity leave so that we're not financially forcing families to go back to work faster than that breastfeeding bond is ready for. Every aspect of our society, the hospitals, the family, the policymakers, the workplaces, the partners, the mother, the grandmother, the aunts, they all need a cultural shift in education. And so it's our job and our responsibility to advocate not just for the mother education, but every aspect of her birth team and her immediate support team. We want to talk about her breastfeeding goals. We want to help there's a smooth transition if the baby is delivered early in a NICU plan. We've got birth plans. Why don't we make breastfeeding plans with our families? Why don't we talk about the different options? Even if she ends up with a C-section, even if she's separated from her baby, how can we make breastfeeding successful and be a core collaboration part of the bigger team that's supporting the mother and the baby? So families need to be supported by their community. These are some great studies out there, policies, things that you can use to reference. There's a lot of legal laws and things out there to advocate for public breastfeeding. We need to be supported more by our healthcare system. A lot of the hospitals are implementing the 10 steps for successful breastfeeding and becoming baby-friendly hospitals, but not all are. And it's really important for us to find out, is the hospital, whether we're a doula, we're a lactation consultant, is the hospital baby friendly? What are the policies like? How are the mothers treated? What's that hospital success rate? Just like the C-section rate is across the board in many facilities, it's the same concept with breastfeeding success rate. What are the provisional health policies that are available? What are the WIC programs? What are the well child checks like? What are the pediatricians education, the nurses in those settings, the lactation support, the counselors, the WIC programs? What is it's one of the books that I read, it was amazing to me. Most of our WIC programs are sponsored by formula. The grants are sponsored by formula. There's massive conflict of interest and biases present in our educational system with these government programs that we have to get to the root cause of. The baby-friendly hospitals can't accept donations of formula, and we need to make sure our WIC and our government programs are on that same standard. So we definitely got some work in progress, but you got to start somewhere. You've got to figure out, we've just got to advocate one woman at a time, finding her a good support group, helping to educate her family, and figuring out what her root causes and worries are. So these are all the different references, and I strongly encourage you just to read a lot of books and really get involved, because birth and breastfeeding has a ripple effect on our entire society. I can't stress enough. I think so many times as midwives and birth professionals, we put so much education and emphasis on the birthing process, but we don't give nearly as much emphasis on the breastfeeding process.